You are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwa. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 62-year-old postmenopausal woman with 8 children presents to her primary health provider with complaints of urinary incontinence whenever she coughs, sneezes, or laughs uncontrollably. Now, further interrogations reveal that this patient was also experiencing vaginal dryness and was also having some kind of sleepless nights and of course hot flashes, especially during the day. Now, this is the case study we have before us. It's going to be a simple one, but there will be a build up on it in subsequent sections. Now, the first question for us is that we said that this patient is having urinary incontinence. Now, whenever we talk about urinary incontinence, it's like urinating, at a time that, you are not aware of something, that is urinating on yourself. That is urinary incontinence. Now, the first question is that, what are the things that most likely, in this patient's case, resulted in the urinary incontinence? And my friends, if you paid attention to the case study very well, this woman is a 62-year-old postmenopausal individual with 8 children. So it therefore tells me that as far as the urinary incontinence is concerned, the culprit has to do with weakness in the pelvic floor muscles, weakness in the pelvic diaphragm, or weakness in muscles that form the pelvic floor. Because of course, continual, childbirth or continuous parturition per vagina. That is one thing I want you to understand. Now, the other thing that could also result in this kind of urinary incontinence could be a cystocele. For instance, if there's a prolapse of what we call the urinary bladder, it could be one of the things which may actually cause this urinary incontinence. But my friends, largely, the whole thing is that it has to do with weakness in, of course, the pelvic floor, muscle. Now, the next question for you is that, what type of urinary incontinence is this? Now, understand that you may have something like urge incontinence, where quickly you want to go and urinate. Otherwise, you may urinate on yourself. That is urge incontinence. And then, of course, we have stress incontinence. For instance, if there's increased intra-abdominal pressure, if, for instance, you cough, you laugh, or you sneeze or whatever, and it causes an sudden increase in intra-abdominal, pressure, what happens is that it can lead to this kind of incontinence. Then it could be mixed. A mixture of course, it could be the urge quickly want to go and urinate, or that kind of stress. Then it could be overflow. So, for instance, if the urinary bladder is full, you may have to, urinate. So, especially individuals who are on catheter and what have you, if there's that kind of overflow as far as the urinary bladder is concerned, the urine will have to come out. So now the first thing is that, what type of incontinence are we talking about? My friends, your answer, as far as this patient's case is concerned, is stress incontinence. Stress incontinence. Why? Because of course, whenever this patient coughs, whenever she sneezes, and of course, whenever she laughs uncontrollably, it results in, of course, that kind of increased intra-abdominal pressure, and therefore putting pressure on what we call the urinary bladder, and of course, the patient is most likely to, of course, urinate on herself. That is one thing. Now, question number 3 is that, if you've seen that the issue, as far as the weakness is concerned, is to the floor of the pelvis, or the pelvic diaphragm, what are the muscles, which are involved? And I want you to also mention the single most important muscle, which is the culprit as far as the urinary incontinence is concerned. My friends, there are 3 muscles which will form the pelvic floor. And of course, they are namely, of course, coccygeus. We have iliococcygeus muscle, of course, coccygeus muscle or ischio-coccygeus muscle. Now, what we understand is that the one which is very close to your urethra is the one which, of course, when the weakness comes in, that is the one that often we see. Okay, because that one, yes, what we see is that, because it also contributes to, of course, the sphincteric, ability of course, that area by way of, looking at the muscle, skeletal muscle, where you control the flow of what we call urine from the urethra. Okay, so one thing I want you to understand is that the culprit is actually the pubococcygeus muscle, the PC muscle, the pubococcygeus muscle. Because that pubococcygeus muscle, which will give off some fibers, okay, to go around the urethra, forming, of course, pubourethralis, okay, in this regard. Yes, it may also give another to form, to go around the vagina, pubovaginalis, okay. It will give some to go around what we call the rectum, puborectalis. So all these three, they are actually modifications of what we call the pubococcygeus muscle. Okay, that is also an important thing which I want you to become aware of. Okay, now the next thing is that if you've seen this, what exercise will, of course, this clinician recommend for this patient as far as managing the stress incontinence non-pharmacologically is actually concerned? And my friends, your answer is what we call the pubococcygeus muscle exercise, the PC muscle exercise. So that one will have to be controlled, that one has to be exercised so that we increase the tone of this muscle. And my friends, the person who also, brought this kind of concept by way of increasing the tone of the pubococcygeus muscle is actually called Kegel. And by so doing this exercise, we also call it Kegel exercise. That is the non-pharmacological, approach that one will have to go through, okay, as far as managing some of these incontinences, yes, are concerned. That is one thing I want you to become aware of. Now, if you looked at the case study, it was also indicated that this patient was having some experiences by way of having vaginal dryness, okay, having some kind of sleepless night at night, okay, waking up to urinate and all that. And then also, this patient, yes, was having hot flashes. Now, so the question is that what sort of symptoms are these? And that is when you need to understand that this individual is 62-year-old and therefore is possibly in her, menopause season. So these are things we can say they are classic, presentations as far as menopause is concerned. Then the next question is that, are these things related to her stress incontinence? And my friends, your answer is no. It has nothing to do with, of course, the stress incontinence that, of course, this patient is experiencing. Okay, so that is one thing I want you to become aware of. And in subsequent videos, we'll build up on this so that, of course, we understand the whole picture as far as, elderly women are concerned. My friends, I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.